GP for Me is benefiting the public in rural and remote communities by ensuring that there will be a supply of physicians and they'll have access to medical care in the future. So the issues facing the communities in the rural and remote division are not dissimilar to other communities. It's trying to recruit new physicians in to sustain the existing practices and to add new doctors. That's hard to do when doctors are working either by themselves or in small individual practices. And there's also a high burden of illness of seniors with complex medical issues and patients living with complex mental health issues. It's hard to serve those populations without a full mental health team. Having an expanded team, in particular the addition of practitioners such as social workers, such as mental health workers, working directly with physicians in their offices rather than exclusively in the hospital or in another venue, has really benefited in terms of being able to expand the services the physicians are able to provide, and in meeting some of the unmet needs around the social determinants of health. These new strategies have taken some of the burden off of GPs so that they're not trying to be all things to all people. They've actually got a team that they're working with, and that makes their practices so much more sustainable. Well, I'd like to point to the example in Salt Spring, for instance, where we've hired a social program officer, and already that's showing benefits to patients, benefits to physicians, and that individual acts as a connector with the rest of the mental health team. So it's showing great promise and great success, even though the position's only been in place for a couple of months. Well, GP for Me initiative has been inspiring for our entire division in that it's enabled us to work together across communities. While we identify specific issues in each community, there's a commonality, and it's given us an opportunity to work together to compare successes and to basically learn from each other. So it's been a very energizing exercise for the rural and remote division of family practice.